By then, roughly 90% of Irish men and 84% of Irish women are expected to fall within the category that ranges from overweight to obese. Well, to see what can be done about this at national level, it's a pleasure to welcome to the studio Rochelle Flanagan, a dietitian and CEO of the Irish Nutrition and Dietetic Institute. Rochelle, it is a kind of almost like wallpaper, this type of information, but this seems to be really we're the worst.
Well, it's not surprising because currently we're fifth in Europe in terms of our levels of obesity. I suppose what's scary is that we're obviously going to suddenly zoom up to top of the rank.
What age group do we need to target in this? Like, you know, I always make a point, as you get older, your metabolism, you know, I find eating the same food, it's harder to manage your weight as you get older. Is it teenagers we need to focus on? Is it older people, or what age group?
Well, we need to tackle it across the board because we're seeing overweight and obesity in all age groups. But I think what's probably the most frightening is in our young children. So in our primary schools, basically 1 in 4 are overweight or obese. So that's 100,000 kids. We've got 6% of our 3-year-olds are currently obese at the moment. 37% of our 7-year-olds are overweight. So, you know, there's a huge issue there at the moment already.
Is it what we're eating or the volume of what we're eating?
It's both. It's a combination. I know it's the same old, but at the end of the day, it's about, you know, taking in too much energy and not expending it. So with the children, basically, it is they're getting too many of the foods from the top shelf. They're not exercising enough and their portions are too big as well. And also in terms of young people, the amount of sugary drinks that they're drinking as well is a problem in young people.
Who are you targeting? Parents, government, schools?
Again, you know, people sort of say, is it personal responsibility? Absolutely. At the end of the day, for children, ultimately, at the end of the day, the child doesn't go out and buy the food. The parents do. And we have a big problem in terms of, you know, parents don't recognise obesity or overweight in themselves, and they don't recognise it in their children. So it's become normalised, and that's a problem. And I think people are afraid to talk about it and, you know, are worried that it's going to cause problems talking about weight. But I think what we want to see is back to when I grew up, you used to have, you know, a measurement done in school alongside your hearing test and your teeth, and
you get weighed.
You know, you got weighed. It was a normal part of the process, and you didn't think twice about it. So there needs to be some kind of surveillance.
You think we don't want to offend youngsters now by weighing them?
Yeah, and we have to be careful. You know, you don't focus on weight with children, but what you focus on is healthy eating and you know, healthy family approach. You know, with children, but you don't speak to them about their weight. You do have to be careful about not causing any issues with regard to their weight. But in terms of GPs and public health nurses and parents themselves, they should have an awareness that their child has a weight problem, and then it's up to them, alongside with their health professionals, to manage that.
And what's changed in society? Is it that we're all couch potatoes, or is it that we want convenience foods that are higher in calories?
I don't know if it's what we want, but I think people have less time, and so the convenience food market has probably exploded as a result because it basically fills a gap. And there is a big issue in terms of...
Are you very anti-fast food?
I'm not anti-fast food. At the end of the day, the food pyramid has a top shelf, which means that people can have, you know, a little bit of what they fancy. What we do say about takeaway foods is try and keep it to once a month. But unfortunately, here in Ireland, it's a lot higher than that. And there was research done in a study for younger people that showed that people who had more than 2 takeouts a week gained 4.5 kilograms more than someone who had less than 1 takeaway a week. So that's a huge increase.
But, you know, I see poor Deirdre at home, like she'd be... By the time she cooks the vegetables, puts the roast on and everything, and then all the cleaning up with the pots and pans, it's hard work.
It's hard work.
The microwave is simple.
Yeah, but it's hard work, but it's worth it. You know, at the end of the day, the thing about the obesity is that 80 to 90% of people with diabetes are obese, okay? And the biggest predictive factor of diabetes is being obese. And with diabetes, you have the associated risk of losing your sight, losing your limbs, having chronic renal failure. People don't understand that there's huge health consequences. And we're seeing with our kids that they're suffering, you know, skeletal problems, high cholesterol, high blood sugars at the age of 8 and 9. Like, it's just not acceptable, you know. So we do have to do something about it. And the parents need to do something about it, and also industry needs to do something about it as well.
I know you say both, but is surely diet is more important than exercise? I find with exercise, it makes you hungry.
Absolutely, it does stimulate your appetite, but again, it's about choosing the foods that are less nutrient dense, so basically don't have as many calories, you know, in the foods after you exercise. There is a problem there, but in terms of exercise, it's very important for your heart health. I mean, if I told you that you could reduce your risk of heart disease cancer or diabetes by 50%. You know, if I gave you a pill, you'd probably take it. And that's what 30 minutes of exercise 5 days a week does for people. So besides weight loss, exercise is very important for your health. But if you're trying to lose weight, you'd have to be exercising probably about 90 minutes a day to lose the 600 calories a day requirement to lose 1 to 2 pounds a week. That's why the diet is the most important focus initially. And then exercise is very important to keep your health up.
And I mentioned that, you know, you can't turn on a radio, TV program or pick up a health supplement of a newspaper without being told, you know, more fruit and veg and all these things. Are people sort of tuning out? It's like, are all these public health messages getting through? If we're getting worse, do we need to change tack?
Well, I suppose in terms of the predictive, I don't exactly know, what the WHO used, but I mean, there is indications that people do gain weight of 1 to 2 pounds a year. Part of that problem is because they're not exercising, they're losing muscle, so muscle basically burns more energy. The other thing is people get older, their metabolism naturally drops as well. So there is sometimes, I agree with you, there's a lot of information out there. I mean, the Safe Food campaign, I think, has been very good at targeting certain things like, reducing sugary drinks and portion control, things like that. But we also need services on the ground to actually help the people who are currently overweight or obese. You want to stop people going from the overweight into the obese category is very important. But there's a lack of services for people who are overweight or obese in this country. And that comes down to the lack of money in the HSC to be able to do something about this, and lack of focus in primary care prevention. And one of the big issues is the free GP care, that really they don't have enough money there. The GPs are not going to be able to manage this on their own. They need more dietitians, more physios, more of the health and care social professionals to actually help people manage their weight.
Rochelle Flanagan, dietitian and CEO of the Irish Nutrition and Dietetic Institute, thank you for joining us live in studio on Newstalk Breakfast.